How old are you?
46.
So it's
I wanted to look not what.
who doesn't?
Uh,
Who doesn't?
I trust your judgment.
Yeah.
For you, it's good if it's gonna be good. You know,
Huh?
I'm famous in Los Angeles.
You are?
Yeah.
Okay.
I can tell you that what I do, I was famous DJ.
Hey, you are DJ?
Yeah.
Excellent.
Yeah, everybody know me. So if it's good, everybody gonna come here.
Beautiful. Beautiful.
my approach for advanced hair loss. Okay, I categorize hair loss into three stages. Okay, first one is mild to moderate hair loss. This is very rare. I mean, we almost never have this type of patient. Very rare, 2-3% of the patient. Mild moderate is anywhere between no hair loss to close to a full head of hair. So most of them, they don't need a hair transplant or they just need a little bit. Okay, so forget that type. Second is advanced. Okay, and third is very advanced. The difference between advanced and very advanced is related to the capacity of the donor versus the demand. Okay, like in advanced, for instance, my rough figure is if you lose around 50% of all your hair volume, I call this advanced. And if it's even more than that, 60%, 70%, then I call very advanced. Why do I call it this way? Because I relate the donor capacity to what can be achieved. Because it decides, it shows me how I should plan it, okay? So you are very advanced. Number one, in very advanced hair loss, obviously, the demand for hair surpasses the supply significantly. Okay, so the need for hair is significantly more than what we can fetch from the donor areas. This is number one. Okay, so related to that, it's impossible to use those available hairs and try to give a typical design low on the hairline all the way to the back, because the area is so large that the density would be extremely low if we tried to do that. And hence, it wouldn't be natural. Okay? For instance, it's a typical mistake a lot of people do. They treat every type of hair loss the same, regardless of the available donors. They design the same way and they try to fill that area. I mean, because we have to realize maybe one of the most important parameters in hair transplant surgery is leveraging between the surface covered versus the density, which work opposite. So the bigger the surface, the lower the density will become for a given number of hairs. But we have to realize that density is as important as the covered surface, if not more important. I think it's more important. Because what happens is, if you use a limited number of hairs to cover a huge area, the density will be so low that visually it will still look bold. So if we have to weigh, density is extremely critical, and if you go below a certain density threshold, even if you transplant hairs, it will not translate to a result visually. Okay, it doesn't give you enough density. So I make every effort to reduce the transplanted area into an area I can control, so I can get a good density there. Okay, but this means considering where I don't want to transplant. For instance, nobody ever thinks when they want to design or consider a hair transplant, nobody ever thinks about where they don't want to transplant. They always consider where they want to do it. But they don't think about where they don't. Of course, when I say we don't want to do it, it doesn't actually mean we don't want to do it, but it means where we want to sacrifice in order for a better density in a more important area. Okay? In very advanced hair loss, the areas to sacrifice are two main zones. Okay? One is hairline. So the placement of the hairline is extremely important in determining the surface area of the transplant. Even a seemingly slow change in the height of the hairline will change the demand for hair dramatically. Okay? It's also because the width from left side to the right side is widest at the hairline versus, let's say, the top. This means that the height change will increase the surface very dramatically depending on how low it is set. Okay? So, since we are looking for every way to reduce the transplanted zone for a good density and natural result, the first is to sacrifice on hairline design and make it as receded as possible. This, in most cases, is contradictory to the instinct of the patient, who is looking for a very youthful-looking hairline, suffering from hair loss at a young age. But it's the fact.
Yeah.
So the more receded the design is made, the more controllable the recipient area, and hence a higher density and a more natural appearance. So in its practical sense, in very advanced hair loss, I will recommend not to design a typical looking hairline. It will be very receded. I will show you in a minute. Okay. The second area of sacrifice, that is the area I don't want to transplant, is lower crown. So, with people with advanced and very advanced hair loss, in my experience and most other professionals, it's actually a practical must to sacrifice some of the crown. In other words, you cannot keep chasing the crown, going down and down in years, because the area is so huge that eventually we will lose. So it's best at first place to decide the shape and design of a thinning crown and to never exceed that border and not waste hairs in that zone. Okay? This again is contradictory to the instinct of most patients who are, most of them are hating a balding crown. It's contradictory, but again, it's a practical must. If you want natural results and reasonable frontal and oblique view, you have to sacrifice lower crown coverage. Okay, so now I'm going to show you how that is done. Okay, please hold this mirror. So, the design is shown in the purple line in the front. Okay, this is how I plan on designing the frontal aspect of the transplant. As you can see, that's right. It needs to be as receded as possible. Okay. And it needs to concentrate the hairs where I'm just putting my palm, because this is the must-do area for a natural result. You need this area here at a reasonable density, so to have a transplant that you can say, okay, I now look better. Okay, so another way around, if we cannot provide good density here on top, we cannot talk about a hair transplant that actually improved one's appearance. Actually, there is even a chance you could make it worse. Because believe me, baldness is not the worst thing you can have. The worst thing is to have some hairs but looking extremely unnatural. An example would be like if you transplant this area here and not have enough hairs behind it, this will mean everybody will tell you had a hair transplant. On the street, whoever you see, oh, he has a hair transplant, oh, he's had a hair transplant. That's disastrous in my opinion.
And these areas, if I come in back in 1 year, can be filled up?
Okay, so I'm going to get to a second topic.
Okay.
The second topic is every question you're going to ask me, starting with can we or can I?
Yeah.
Okay? Now, everything I just explained is about what I believe we should be doing, not what we could be doing. Because if you ask me what we could be doing, we could be transplanting hairs under your foot if we wanted to.
Yeah.
We could do anything. Transplant hairs like a 14-year-old. Anything. So it's not about could we do it. It's about should we do it. Okay? Of course, in my experience. And don't forget, this is subjective. Every other person could disagree and claim different. With my experience, what we should do. Okay? So I'm going back to what I just explained in the last 15 minutes. It's we should not try to transplant a typical hairline, and we should not try to transplant the lower crown. But could we do it? Yes. So I'm not saying we can't do it, just saying we shouldn't do it. Okay?
Today.
Today and never.
Oh, even
Never. That's right. Because if I were going to do it in the future, why wouldn't I do it today?
Because you don't have enough grass.
No. But I could add later.
Okay.
So the first hair transplant is supposed to make your lifetime design if it's done correctly.
Okay.
And you should stick to it as long as it's correct.
Okay.
So what I'm trying to explain is in very advanced hair loss, it's wrong to try and make a low hairline. And it's wrong to try and transplant the lower crown in most cases.
Okay.
It's a mistake. But can we do it?
Yeah.
Sure.
Yeah.
Is it your life? Yes. Is it your money? Yes. Could I do it? Obviously. Why not? But this is just to share with you what I believe is the best way to do it.
So you did it to do it one time?
No?
No?
Even if I did many hair transplants, I would work on this design.
Oh, you're just gonna add the same.
Yeah, so what I would do, let me give you an example. Okay, so I would transplant this area here. If I had the chance.
To look too big here as far as.
Yeah, but see, this is difficult for patients. You know what you don't want in some aspects.
Yeah.
But there are things like an iceberg where you wouldn't want, but you are not aware yet.
Okay.
So you can only tell me what you don't want outside the surface. The ones that are hidden below the iceberg, I know them. You don't know them. Okay? Seeing tens of thousands of patients.
Yeah.
Okay? So this is why I would recommend working on this design. This design would be densifying this zone that I just marked. So this is basically a receded hairline and transplanting the frontal 2/3 of the balding area. The lower 1/3 is sacrificed for the goal of achieving a higher density in the front 2/3. So if you came again, let's say, I would look at the density and maybe I would like to even densify more. Or maybe I would narrow down the crown. Let's say if I left a certain crown, then maybe I would try to make it smaller.
Yeah.
Maybe, probably not, but maybe I could think, oh, can we move slightly the hairline to the front? Maybe. I don't think so, but it's a possibility. Okay, but I would stick close to the first plan because I believe in it. But don't forget, these are not the limits of what we can do. We can do whatever you want. Tomorrow, it's your life, it's your future, and it's your appearance. Okay? This is what I believe.
Okay.
But
I just think that this too big of a gap on the side.
okay, so you're gonna think about, see, I can only pass on a certain amount of my experience in the limited minutes we are having here. Can't share like 20 years of experience.
Of course.
After that, you have to judge for yourself and tell me tomorrow morning whether you decided with this recommendation or any other plan that you want. We can do it. Okay? So we can do any other plan you want, provided you sign a written consent that you want your own design and not the doctor's recommendation, because there's going to be consequences.
Yeah.
And we will do it. So you will think about it tonight. If you have objections or any other opinion tomorrow, you're going to tell us and we're going to do it that way. Okay? But yeah, this is what I would do on me. This is what I would do to a brother. This is what I would do to a relative. Okay? Like if you were a brother, I would refuse to do your transplant if you didn't go with this plan. But you're not my brother. You're a nice, famous, beautiful client. But in the end, you're not my brother, which means you're free to go with any plan you want. Like if we were brothers, I wouldn't allow it. I would say, well, go somewhere else. But you, not going to do that. I'm going to say, we can do whatever you want. So you can see that I'm sincere about my recommendations. But as I said, the final decision will be up to you. Okay? So think about it. Please don't wash the design tonight. You can kind of show your body if you want, but don't wash my design because we're going to follow it tomorrow. And as I said, consider the things I said. And then tomorrow, if you have a different desire, you need to tell us and we will do it.
I can tell you, the only thing I think, like everything, I trust your judgment. But if it's possible, I don't know.
Everything is possible.
I know. Like if you think that if a little bit here to fill up, a little bit in these corners, at least.
Everything is possible.
Yeah. Because it's still hair going there.
It doesn't matter.
So
that's not a criteria. Like we could have scattered hairs growing in our forehead. It doesn't matter. We do not have to follow those hairs. We can make our own plan. So I don't have to follow those hairs. Yeah, there's a reason for everything I recommend, but as I said, they're not like the law. It's just recommendations. Okay? Alright? So thank you for coming, and I'll see you tomorrow. Okay? So my friend's going to take a few pictures of the drawing, and then you can go back to the hotel.
Okay.